Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name is Carl McPhillamy. I am 66 years of age and was born in Coventry and lived and worked for most of my life in Coventry. I did move to Leicestershire about 28 years ago whilst still continuing to work in Coventry for a considerable number of years, but Massey Ferguson, my employers, closed down lock, stock and barrel in 2003 when I was then aged 55, but I still had 2 of my 3 children in full-time education, and although I didn't know at the time, they were not only did they do school education, they both went on to university, so it was apparent to me that I had to sort of carry on working, but working as something that would sort of pay the bills. And to that end I was successful in landing a job with Royal Mail, who were, fortunately for me, just setting up a new operation, a national distribution centre at Crick, which was certainly a less of a commute than I was already doing in Coventry, and I spent 6 pretty happy years there. Unfortunately, they had a reorganisation and they deemed that people with less Royal Mail service would have less choice of the shifts of jobs, being as this is a 24-hour operation, and I found myself on nights, sort of managed to change shifts, but it was always a danger to go back, and I was pretty certain that at that stage of my life and living near a main road I didn't want to work nights. And another stroke, I suppose, of good fortune was that they had a redundancy programme, not so much with Royal Mail, but as most people are aware, there's been massive changes, and they sort of allowed people to go from one place to allow their job to be fulfilled by someone from another place. So I availed myself of that opportunity and got some money, obviously not a great deal, but enough to sort of enable me to take a punt on finding something else, not having a gun to my head straight away. And luckily for me I did, and found a job which is probably the most rewarding and pleasurable job I've ever had, driving vehicles all over the country. The job title was plate driver. It involves driving on trade plates, but I was always was going to get work as part of a team and get picked up and not necessarily spend endless hours by the roadside. However, unfortunately, I sort of had a problem, went to my GP, resulted in a diagnosis of bowel cancer, and the nature of the treatment was a daily sort of obligation initially, so I had to stop work then, had subsequent surgery, chemotherapy, and that my employers were very supportive, so I felt that I wanted to try and go back to the job that I did enjoy, but ultimately I had to give way to the fact that I had a stoma and needed regular access to facilities.
Carl, thanks for coming in today and sharing your story with us. I really appreciate you coming in. I mentioned we haven't had that many people who've had a colorectal or bowel cancer, so I think many viewers would really be interested to hear about your experience. The first thing that occurs to me is to ask you how your diagnosis came about. What early symptoms were you having, and was it screening? You know, how was the diagnosis found, as it were?
Well, I noticed when passing motion, traces of blood, not great, but consistent and persistent. Most people are aware of the television sort of publicity. If just such a thing occurs, that it's the responsible thing to do to mention to your GP. I wasn't too concerned because I was already in the screening system, which is offered to all people of a certain age. But nevertheless, I did go to the doctor in a fairly cavalier mood, I suppose, just because I thought I'd better do it, and because I had mentioned the problem to my wife and got the necessarily sort of nagging to do so. I did, and that started the sequence of events which quite rapidly led to the diagnosis.
With those early symptoms you mentioned, were you worried there was something serious or sinister going on? Or did you think, you know, this is just a routine thing, we can probably get this sorted?
Yeah, I thought it wasn't very dramatic. And as I said, I took some comfort from the fact that I had been screened within 2 years, obviously. So no, I wasn't fearful. I mean, I don't know much about medicine in general, but I know bleeding occurs for other reasons. I've heard the words polyps mentioned, and of course there's the old familiar piles that everybody makes jokes about, which I hadn't experienced before, but wasn't impossible for that would be the diagnosis, which I would have welcomed in these circumstances.
So you went to see your GP. Now, how did you feel was the reception from your GP? How much did they take it seriously? Well,
I took it very seriously because, as I say, I hadn't prevaricated for ages, but it took me about a month to even consciously think, well, this isn't right, and this isn't a one-off. But so when he asked me how long it'd been, and by that time, because you make an appointment which isn't instant with a GP, but when I did mention it, probably about 6 weeks had elapsed, and he straight away, rather than shilly-shally, he suggested that I had a colonoscopy, purely as a precaution. He said, I'm sure there'll be nothing wrong, but, equally I shared his optimism and thought, well, I'm not going to fly in the face of the advice, so I duly received an appointment date, possibly within about a fortnight. It was fairly short time span between this conversation with him and receiving the appointment. Possibly I'd guess at about 2 weeks, but I wouldn't be held to that.
We have this new standard in the NHS regarding referral. If the GP suspects a cancer, then the hospital is meant to deal with it within 2 weeks.
So that's
about what you experienced there.
Yes.
And what was the next step then from the hospital? You had the colonoscopy, I presume, which is an examination of the bowel. What was your experience there like?
Never having been there before, there was a number of people having the same procedures. I suppose like any clinic in any situation, they do a job lot, so to speak. But the first part of it was to have an enema, which I've never had before, and I think most people, if only in a joking way, have got a rough idea what it's about, and it's not overly pleasant, but was obviously totally necessary to empty the bowel for them to have a look. So I went through that. I suppose everybody's experience of that is the same. You empty the bowel, but you know, it wasn't traumatic. It was just strange. But I then had the colonoscopy, and it was apparent from the reaction of the gentleman doing it, whether you'd refer to him as a technician or a doctor, I don't know, that he immediately, quite briefly into the procedure, was aware of something that seemed to not alarm him, but arouse his suspicions, and he referred to another colleague, possibly a senior, I don't know, for guidance and another opinion, and the noises he made indicated that he shared the concern. He suggested to the first guy that he did a biopsy at the time, and I was offered the opportunity to turn my head and look at a screen that could see both the sort of probe and also the abnormality, which seemed to me to be a red bloody area in what otherwise seemed to be a pink area. So
that's a very good description. Do you think it was worth and correct them showing you the actual abnormality, because you were there at the time?
I think it was, because they didn't force me to look. No. I mean, it did, actually, I could have looked through the whole thing, and like most procedures, I wasn't that curious. I was not bothered to look. But as soon as the alarm bells were sounded, then things changed, and I thought I might as well look to help me to understand what they're saying as much as anything else.
Yeah. Just out of curiosity, was it the setup was such that you could see what was going on almost like accidentally, or was it designed to help you see?
The screen was easy to see, but you had to turn your head, which wasn't difficult, but equally I could look straight ahead and ignore it, or I could turn my head and observe.
So there was this suspicious area. They took the specimens from the sampling at the time, and obviously they would have sent those off. Did they say any more about it at that time, or was that left to a follow-up appointment when they came back?
I think everyone sort of goes and gets changed, because you're in a hospital gown at this point, and most people seem to have some sort of follow-up dialogue from a doctor or person doing it. And because while I was sitting for mine, I heard reassuring noises being made to other people about polyps, and there shouldn't be. But the gentleman who did my procedure, and it was somewhere near the end of the working day, did sort of talk to me whilst I was waiting for this dialogue, and he did say that it would probably need surgery to correct it. He didn't venture a diagnosis as such, but and as soon as he said that, and the fact that he took the time to shake my hand and wish me well, and made me realise that this was something relatively serious.
Yeah. So we heard there about the diagnostic procedure, the colonoscopy, and you were called back to the clinic for the results. You told me there was about another 2 weeks.
To the best of my knowledge, yes.
When you came back. So what did they tell you when you came into that critical meeting?
I was accompanied by my wife, which was good, I think. I was told basically that the biopsy had proved cancerous. That sort of resonated with me for a bit, but he did say that it was not very far in the rectum, that it was treatable and possibly curable. But obviously he didn't assure me of that. He then explained that it would be a fairly long road, that his part in the cure, or in the treatment, is as a surgeon to remove the tumour. But prior to that, there'd be sort of shared care between himself and an oncologist, who I believe is the job title of a Mr.
Osman, is it?
Osman, Mr. Yes. Osman. Yeah. So I then quite quickly was sent to see Dr. Osman, which was at the LRI, as opposed to the Leicester General, which is where I had my dealings with Mr. Thomas.
Yes. So if I can understand correctly, they wanted to start some chemotherapy prior to the surgery to shrink the tumour a little bit.
Yeah, it was explained that be considerably prior to that. But he said the surgery will be a long way down the road. So let us concentrate on the first parts.
Okay.
So I went to see Dr. Osman, and he told me that the time was of the essence to start radiotherapy in tandem with chemotherapy pretty promptly.
I see.
So I had an appointment which was basically just to measure me up and mark the target area for the daily radiotherapy, presumably so they didn't waste time in and were as accurate as they could possibly be each time. That went on for 5 days a week for 5 weeks, the exception being the weekends.
Yes.
But even bank holidays were not accepted, and I did go in on bank holidays. I was taking oral tablets at the same time. They were prescribed at the LRI, and each time they were prescribed, there was a sort of a check on how they were affecting me, and there was cycles. It was always 3 weeks of taking them and a week of not taking them, and on the Thursday of that week I would attend my GP for a blood test, which was the results then were in the possession of the clinic supervisor, although didn't always see Dr. Osborne, just to make sure it was safe and appropriate to give me the next course, which they did every time with the exception of one. I did have a swelling of the feet, which is one of the common side effects, and they decided to give me an extra week for that to subside, and gave me some cream, which did help greatly, and I applied that daily, and thereafter it went on till I completed the course.
How difficult overall was it to tolerate the radiotherapy and or the chemotherapy?
Well, the radiotherapy was a kind of non-event insofar as I just positioned myself. They lined up, they went out of the room, but assured me that I could attract their attention to any form of distress. And the whole procedure was probably barely 5 minutes, and was painless, and I was just unaware of what was going on. There could have been nothing going on as far as I was concerned, but so clearly there was.
It was straightforward.
Yeah.
And the chemotherapy?
The chemotherapy, it was a question of discipline to get in the habit. I had to do it twice a day, and there was 4 different tablets each time. I think it was because I understand that each dose is designed for you personally, I suppose, relevant your body mass and everything else, or what they're trying to achieve as well. I don't know, but provided you remembered to do them, and it was always at least 8 hours apart. Now, it was stressed to me that was pretty important. So fairly obviously I would have one at breakfast time and one with my evening meal, wherever the situation allowed, which it did 9 times out of 10. But I was conscious of, very least, of having a minimum of 8 hours. If it was 10 hours, I don't think that was an issue, but fairly obviously you couldn't just get them down your neck and be done with it. You had to give them the chance to work as I was told they should.
Yeah. So were you attending for that on the chemotherapy suite?
Yes, you sat in the chemotherapy suite and went into the room where people were having it intravenously. So it was in a waiting room with a lot of other people, and I spent some time in the waiting room because they're busy people, I understand that.
Yeah. Now I'm interested to know how you felt that atmosphere was there, because it's quite busy, but you get exposed to different patients, potentially, you can make some friends there, and hear how other people are getting on.
I think people tend in a situation like that to be talkative, even those who are probably a little more reserved normally. Not in great depth, but usually it progresses to what specifically is wrong with them and their little experiences, and you do tend to swap them without being overtly nosy, and not because you have got to pass the time somehow, and
Exactly.
you know why they're there, and they know why you're there.
And did you actually make those contacts, friends if you like? By that I mean people who you stayed in touch with outside of the hospital.
No, because there was often not the same people, because some people were probably there weekly or even daily.
Yeah.
I was there every 3 weeks, that's all, really.
Yeah, so there was a different cycle of people.
The time wasn't always consistent, so again, it wouldn't have been the same people. So I didn't have the continuity of rapport, but as I say, if you spent 20 minutes speaking to somebody, you might see them again on the way in or the way out, and you would nod, acknowledge them, but there was no greater social contact.
I'm going to skip ahead a bit here, but did you ever find a contact with any patients, even later in the cancer journey, that you found was valuable to you? And if you didn't, would you have felt that would have been useful to have been introduced to patients in a similar position?
I think it possibly would, especially someone who experienced the surgery I experienced, because I've never ever spoken to anybody, even to this day, who has had that experience.
Yeah.
Which is hopefully one of the reasons I think maybe this will help somebody who does face it.
Exactly. Now I'm wondering then, after these initial investigations, then the chemotherapy and the radiotherapy, everything seemed to be going well. Was there much time until the actual surgery occurred?
Well, communication did seem to cease. I did expect an appointment, albeit the appointment for surgery to be a month, 6 weeks down the road, but I expected a date, but I didn't get a date. And when I was contacted by Mr. Thomas, he said that one of the scans, I believe it was the MRI, revealed an abnormality in an adrenal gland. He said it was, don't get too concerned by it, but he wished to investigate further, and that involved something called a PET scan, which is done in a mobile unit. And so I had an appointment, kept the appointment, and the results of that weren't sort of explained to me precisely, but nevertheless it was deemed that it would be a good idea to remove the adrenal gland at the same time as had this cancer surgery.
Right.
Which I can fully understand why meant that you had to get two guys together on the same day, both who had, I'm sure, busy workloads, so that would make it more difficult than the one, and they presumably had to operate in tandem and had other things to do that day. So I could see logistically it wouldn't be easy.
So you actually had two surgeons operate at the one time on those two separate areas. So
Precisely.
You had one anaesthetic, and then afterwards, you had that result.
And once I was getting ready to go down to be anaesthetised, they both individually came and introduced themselves to me, which was nice in one way, but I have got a little anecdote about that. Because there are two adrenal glands on the human body, a left and a right, and when Professor Nicholson came to introduce himself, which I didn't expect, so Mr. Thomas probably, because I had quite a lot of dialogue with him, but he did say, I believe, I will be operating you today, I'll be removing your left adrenal gland, and I'm sure, I was positive that it was the right one. And I mentioned this to him, and he said, don't worry, I'll go away and bring it up on the system, some computerized system that accessible to him at the time, or should have been. But he came back in and said, unfortunately the system was down, but he says, don't worry, we have that same system in the operating theatre itself. But I sort of got rather worried by this. It's almost like it's something out of a comedy sketch, but so I did get taken to the wheeled down to be anaesthetised, but I was talking to anyone who would listen, possibly the cleaner, anybody, to make sure they get the right one, sort of thing. But,
you were shouting out.
Yeah, well, I was talking to anybody who might listen, so some of which probably were irrelevant, but it was a bit like the sort of music hall joke of the bloke who has the wrong leg removed. I knew it, part of me, that they know what they're doing, but it isn't the ideal sort of conversation to have immediately before you go down.
No, that's anxiety provoking for sure.
Yeah.
But let's cut to the chase. You then came round from the operation. What's your recollection of that?
The recollection of that is being very cold, very, very cold, and shivering in an involuntary manner.
But was it on your mind about the left and the right?
I don't think so, to be honest. I mean, when you come round, it was where am I was it didn't pick up on everything straight away. There was like a recovery area, and there was a guy, presumably an anaesthetist or so, keeping an eye on me, and I think I later learned that they had trouble regulating my body temperature, and so I stayed there for longer than probably is normal, and which caused concerns for my wife, because I went down in the morning and still wasn't back at 8 o'clock at night.
Now, what was the overall result as far as you were told? How successful were the joint procedures?
I wasn't told there and then, obviously. The first time I was told was within about 24 hours. I was visited personally by Mr. Thomas, who said everything had gone well, and said he was pleased with the way things had gone. So I thought, well, if he's pleased, I'm pleased.
So he was pleased, but did you later, when you came back for that review, receive any further details about anything that was sampled at the time, any staging, the outlook in general, any further kind of refinement?
No, to be honest, no.
Did you ever receive that information?
Not that I can recall, no.
And what does that mean in terms of your confidence now for where you are?
I just try to be optimistic. I suppose one of the most reassuring things is, even prior to diagnosis and all through the whole piece, I have felt and appeared to the outsider relatively well.
And is that reflected in your day-to-day function, meaning your activities are essentially preserved?
Ironically, it did initially for quite a long time, because I did suffer a domestic catastrophe which sort of took my mind off things, and I did concentrate all my energies upon that. But when life settled down, and ultimately I realised that I couldn't continue with my work-life sort of balance, I did sort of encounter problems, mental problems, depression.
Let's talk about that in just 1 second, if you don't mind. We were talking earlier there about the recovery period. How long were you in hospital for?
A week, exactly a week.
And do you feel that you left hospital optimistic that things were going to improve?
Pardon me. I left hospital feeling queasy. I wasn't sure that it was a brilliant idea, because I had to wait in a waiting room, and it seemed that the decision to release me was made by Dr. Thomas, or Mr. Thomas, and I sort of wasn't expecting it, and I didn't. A day when I probably felt a bit more queasy than I had done. So, and my wife, having visited me the night before, she didn't expect it, with the result that she was at work, and she did come and fetch me, but it took an hour or two, and I felt rather ill in this sort of area where I was given to wait whilst waiting for her, and in the end I actually went and lay on a trolley somewhere near to where the whole adventure had started when I came in, courtesy of the nurse who was looking after things, just to make me feel more comfortable. So really, I didn't feel, much as I've said, I felt well through the whole piece. I probably have felt as bad as I ever have on the day of discharge.
Okay. Right, so I've heard about the operation, and you described that in very clear terms. You had the two surgeons operate on you, and you were discharged from hospital quite quickly, as it happens, as is common in the NHS these days. But there's a big hurdle to overcome then, which is trying to find your feet again. And for you, there was also the issue of this stoma care, wasn't there?
There was indeed.
So
yes.
what was the effect on your body and how you were going to cope at that point?
Well, the nurses on the ward initially were changing it for me, and within a day or so, when I was able to, with their guidance and supervision, to go, when I got up and had a wash, I would change it myself there, and they would sort of make sure I'd done it right, sort of thing, which, to be fair, isn't very difficult. I think one of the main things is to make sure that you have everything to hand before you start, because the soil bag needs to go in a disposal bag, but it's not much point in going around looking for that when you've already detached it from your body. But I think, so it's stressed upon me there's about 5 things you need: swabs, adhesive remover. You need them all to hand before you do it. And also within about 48 hours, a security care nurse who works in tandem, I believe, with the National Health. So she is a nurse, or certainly wears a uniform and is there with their approval, and they advise you and teach you a bit more, and explains that one of the vital things is to ensure that you have adequate supplies at all times of these 5 or so items, and that they didn't have to, they could supply them to me, so I wouldn't have to chase about rounding them up or worry. And also that they offered a laser cutting service, because initially you have to sort of measure the size of your stoma, and with a fairly crude card ready reckoner, and you cut them with a pair of scissors. Well, obviously, depending on your accuracy and dexterity, is how good a fit they are. Whereas, once it's settled down, they size it, and thereafter they will be pre-cut to your personal requirements and delivered to your door. So there didn't seem to be much of an argument about not availing myself of their facilities.
Now, some people will be new to this whole area. Maybe they've just received a stoma and they're not sure what they can do and what they can't do. Were there any restrictions, first of all, on your lifestyle as a result of that? Were you advised to make any changes?
Well, initially, since it is a wound that goes through the stomach wall, I was advised not to drive for about 6 weeks. And when you do, to sort of do an imaginary emergency stop, because I think that is the main thing, that you may not be able to move your leg and you're quickly in an emergency, and if you do a sort of trial run, at least, and you experience pain, well, perhaps I better leave it a bit longer.
And any other restrictions, for example, going out, socialising, eating meat?
No, it was explained to me that everyone's a little bit different, and certain things would make the stoma more active, and that I really would have to learn that to myself. But there's a few obvious guidelines like greens, onions, that are pretty common to everybody. But it was really a trial and error basis, and to eat not big meals straight away, but little and often, I think, is a cliche, really.
Yeah. Now, everyone's afraid of having an accident outside and things getting out of control. Can you make any comment on that? How likely is it? Did you have any problems along those lines?
It is possible, and I have, unfortunately, been in that embarrassing situation. It's mostly avoidable with a bit of forethought. What I often do, if I've got an appointment in the morning, I get up rather uncomfortably early because I've found the stoma active during the night, get up, change, but I've found from personal experience that a second change is necessary fairly soon afterwards, but thereafter the whole thing settles down. So I found that if I just got up, do the one change and fly through the door, I would probably be looking at another one sooner. So that while it's not an exact science, that's one thing you can do to help yourself. And the other is, if you are going to go for a curry or a pint, do it on a day when you're not going to do much the next day, because I think I've learned that you might as well have what's not denied you, but realise that not a price to pay, but a consequence.
Yes. What about going out in general? Does it affect, in your opinion, confidence going out?
Yes, I think so, because most people who know you are aware of what you've been through, and you think, are they looking to try and detect it? In actual fact, there isn't a lot to detect if you use your common sense and wear loose-fitting clothes and use your common sense to. But I probably my own worst enemy. I developed this nervous habit of touching it for no good reason.
Yes.
Which is kind of drawing people's attention to it anyway.
Yeah. Did you ever find anybody made any comments that were hurtful or uncomplimentary?
No, I did not. Not in my earshot anyway.
No. What about in terms of cancer in general? How did you find the reaction of friends, acquaintances in general? Not necessarily about the bowel cancer or the stoma, but in general, the fact that you'd been ill.
Well, they were pretty supportive, and I was visited by both family and friends in hospital. And importantly, I think, when I was discharged, they took the trouble to come round, which was reassuring.
Yeah.
I mean, obviously, I was probably in my dressing gown, and I couldn't hide what was what, and I did feel a bit tired and a bit weak. But I wasn't, being their close friends, I wasn't ashamed or uneasy about that. As regards going out, as I say, it's probably irrationally, overly aware, but I think you can build it up too much.
Yeah.
And that you do need a bit of guidance in ways to load the dice in your favour, which I'd have subsequently had, but wasn't forthcoming as quickly as perhaps I would have liked it to have been.
There's another side to this which I want to ask you about, if you don't mind, which is about the effect on your home life, your family, your wife. How much is that affected? There's the angle of how much does your partner accept what's happened to you?
I think she has been very supportive and doesn't sort of shy away from any aspect of it, especially when I needed help with changing the wound that immediately followed the removal of the rectum. I think she was surprised how well I coped initially, but by the same token, surprised that it wasn't a graph that was a continual rise. In fact, it dipped, and I think that baffled her and confused her at the same time, given that she was still doing virtually everything around the house. I mean, I could genuinely do very little in the early days, plus the fact that she's still working, and she had quite a lot of experience of relatives and illness immediately prior to that. I think I was surprised the way she took this next episode in her stride, but then I think was annoyed with me or found it difficult to understand why I slid backwards.
What was your wife doing at that time, career-wise?
She is an administration assistant at an education college.
Did you find that she had to take any time off in her job?
She took time off for my various appointments in the preceding the treatment, i.e. when I went to see Dr. Thomas and one or two others with the nurses. She also took me in on the day of surgery, spent quite a lot of time there, but I think till about 8 o'clock at night, but being as she still hadn't seen me, so that probably took its toll. But
did she have her own source of help, friends that she relied on?
She's not friendless, but she hasn't got much family. She's got no sisters or parents. She's got our 3 children who definitely were interested and supportive. There's no problems in the family unit as such.
No, but do you feel that she would warrant extra support? In general, do you think family members who are going through this should have extra support as part of the system?
In an ideal world, possibly, but it's very hard to know in an obvious way how that would have helped her cope, to be frank.
I'm interested in something you mentioned earlier. It's relevant to a lot of people, which is emotionally, what was this journey like? And did you suffer some low periods or anxious periods where you were struggling at the time?
I'm afraid I did, but it was quite a way down the road. But I think the whole thing was clouded a bit by the fact that I had to move house due to flooding, which initially I had to apply my mind and time to. But once that was resolved and I moved back, I then learnt that I had to have a further 6 months chemotherapy, which came as a total shock to me. But I hadn't picked up on it if it had been mentioned before. It was explained to me that it was like a mopping up exercise rather than anything to be alarmed about. So that meant yet another 6 months of the routine of going to the LRI on the cycles as I outlined before, which meant that it was a longer time that before I could return to work, because fairly obviously I think if you're taking chemotherapy and there are side effects, you don't want to be driving for long periods in strange cars. In fact, I think my employers would have poo-pooed it anyway. So that was a further delay. But when I did finish that, almost immediately I thought, well, they've been good to me. It's been a year now. I haven't been back for a year. I must get back. So at the first opportunity, I went to my GP, asked him to sign you up, because you can't go back until you have a note to say that he's willing for it. He did advise a staged return to work. By that I think he meant days and hours. And whilst my direct superior in the organisation was wholly supportive, it was a hard thing to enact given the nature of the work I did. In other words, if you go out, you might send you out to somewhere that you would reasonably expect to be back by 12, but you might get stuck on the M6 or something. You couldn't say finish at 12 because you can't park it up in the fast lane and go home. So that proved hard to put into practice, although it wasn't an unwillingness. And sometimes if I'd done a full day, he would let me go out early, which was kind of him, but B, made me feel a bit that I'm not really back full bore. I'm, needing special privileges, and so, and I did also get tired. I did get tired with driving, and I got up rather early, and some I've touched on before, to make sure that I gave myself a reasonable chance of not being caught short, for want of a better expression. And he picked up on this tiredness, and it went on. I managed this for about 5 or 6 weeks, but he picked up on it, and he said, have the rest of the week off, which was kind of him. And I did, but then I spent a lot of time on my own, because my wife works full time, and there was things that hadn't been remedied in the house which were going wrong, and I think I made more of them than they were. And because, long story short, with not having any focus of work and the rapport and the crack that goes with that with colleagues, being on my own and thinking, well, this is it has changed my life, and I became rather lazy and slothful, and it seemed that even very small routine domestic chores seemed very onerous to me, and it wasn't just skiving, and that progressed then to the weekends. I didn't want to do anything at the weekends or go out shopping, and avoided social contact really.
Was it a sense that your fatigue was higher, or was it more a loss of interest in motivation?
I think the latter, the motivation. I was tired, but I mean, you can do most things when you're tired. You just do them for less time. But it was, I just couldn't be bothered to do the most basic of things.
It sounds like it was quite closely related to the change in your role, given the work had been interrupted, and you were working quite hard before this. In other words, did the inability to go to work at that stage, did that affect your self-confidence and your self-esteem?
Most certainly. It's just too much of a coincidence.
Yeah. And were you able to replace that activity with anything else? Not really, because unfortunately, because we are talking fairly recent times, it is the time of year it is, and the weather has been rather appalling. I'm a passionate angler and a secretary of a club, and I've been so for 40 odd years, but one morning I got up and the Stoma was playing up, and I thought, I can't go like this, and I didn't go. But then I didn't go again for about 6 months. I just somehow I felt that because obviously when you go in the country fishing, you're more remote than almost any other. But I've since learned that again, with a bit of prep and a bit of common sense, to give up was wrong, but having given up, and I found it very hard to start again. And it was the same with going in I like a pint, going the village local, but I found that I couldn't be bothered to get changed to go, because most people have a wash and brush up if they're going to go out socialising. Didn't do that, so therefore didn't go. And once you've done it one week, it became a habit as well. Now, we started off this conversation talking about mood, actually. How did it affect you in terms of your mood day to day? Well, everything seemed black and hopeless. And as I said, the domestic problems allied to the flooding seemed to take on seemed to be insoluble rather than dealing with them day by day. Everything got on top of me, I suppose. Yeah. And was that reflected in change in your physical day-to-day function? They call it somatic symptoms: concentration, energy, fatigue in the day. We've mentioned that. Also appetite, sleep at night, any of those kind of things? Certainly sleep at night, because I think being I was fairly sedentary, it's fairly natural, I suppose, that I didn't need a great deal of sleep. You got tired, you had 2 or 3 hours, but whereas if you do something physically demanding, you feel as if you've earned the right. Your body just shuts down for a bit. It never shut down. And then I was spending a lot of time lying awake, thinking not very positive things, really. The world seemed a black place. Negative thoughts. Yeah, I couldn't engage with even my daughter's forthcoming wedding. I paid lip service to arrangements, but my heart wasn't in it. No. So it was affecting your view of the world, really? Definitely so. And was your mind a lot on your illness or the complications of the illness or other negatives that were coming up? I think it was not so much the illness, it was purely and simply this appendage I'd got to deal with, and I become almost preoccupied with it, touching it even more. And I think if you think about it and you're looking to change it every 5 minutes, you probably are, because every little rumble or noise becomes more significant. And I do believe that worry probably affects your stomach, your habit, yes. So that was a factor. So it's self-perpetuating in a sense, yes. I think. Now, people will definitely be wanting me to ask what help you received during this time, either directly for the Stoma care or indirectly for the confidence, the emotional and psychological side. Well, as regards the Stoma care, I was given an appointment in Lutterworth, where I was living, quite shortly after discharge. It wasn't long before I had to vacate my house to allow it to be dried and refurbished. And being as I made confident noises, I think, because I was feeling fairly upbeat at the time, just getting on with things, she more or less didn't make another appointment for
about 8 weeks, because they only do it once a month there anyway, so the options were reduced. And the lady concerned hadn't had much experience of outside clinics, and I appeared to sort of set the agenda almost for the meeting, and she says, do you want me to look at the stoma? Well, whilst I didn't want to make a sideshow of it, I thought it was almost obligatory. And when she did look at it, there was some little infections that were there that could be treated, but I thought, well, if I hadn't showed it to her, she wouldn't know. So I felt that was a bit wishy-washy. But when I did subsequently move back to my property, Hinckley is nearer to where I live. They also do it weekly, although you don't need to attend weekly, but it obviously gave far more options for appointment to be made. And possibly because I began to sort of be mentally affected, the lady was a bit more persistent and diverse in her approach to things, and suggested alternative things I might avail myself of that I didn't know existed. One of them being a plug whereby if you want to go out for a short space of time for a meal, you haven't got the bag, therefore you haven't got the bulk, and you're not worried about having to change it because you can't, but the plug is secure enough that it's going to do the job for a period of time. And she also told me that there's another lady in her care who'd been in my position for 18 years and was unaware of that until she told me. So I was just a little miffed that these various options weren't spelled out to me more promptly.
Yes, they could have been mentioned earlier, but I suppose definitely they were delayed, but the fact you did get them in the end was an advantage rather than missing out on them altogether.
Most assuredly, yeah.
And did they help you actually go out a little bit more at that stage?
She was a bit more proactive than that. She told me this, and she set me certain goals. She said, I want you to go fishing.
Very good.
So although she can't mandate me to go fishing, I thought, well, she's a strong person. If I go and say, no, I haven't, I thought, I've got her to answer to as well as myself. So I did, and I enjoyed it. Similarly with virtually going out, socialising, enjoyed that, didn't feel I was going to be compromised. Confidence.
That's a very good feedback tip for the clinicians watching, that giving that little bit of advice and motivation can help in some situations.
She more or less changed the role almost, not to bully me, but make it sound as if we were in this together. And she was interested, and when I did see her again, I will have her to answer, not to answer, that's probably not a good way of putting it, but her to share the feedback. So,
exactly. How do you spend your day these days? How do you spend your time?
Well, obviously I don't have medical appointments every day. There's still some, but they wouldn't be enough to fulfill a day. Basically, I'm become aware that I need to do things for my own satisfaction and in fairness to the rest of my family. So I try and look at what needs doing, write a list, but I don't always attack it with gusto or even in a logical order. I give myself a list of options, some which seem to have a big beneficial effect to the house, like running the vac round. You can notice I've done it, but it only takes 10 minutes. On others, like a bit of spring cleaning or tidying the garage, which can take a day. And depending on how I feel, but if I find that if I don't, another little thing I did when I was lazy was fall into the habit of watching rather too much daytime television, which is a bad thing. I don't allow myself anything before about 4 o'clock when the quizzes start, and at least I think, well, they're semi-educational or they're not mundane anyway. And I feel that if I've done a few jobs, I then address myself to the evening meal because I can't expect my wife to do everything. And I feel a certain satisfaction from that, and I feel that I'm earning my corn in the relationship, and life I'm not just taking, but I am doing what I can when I can. And obviously, as the weather improves, I've got a mammoth task to resurrect the garden from the flood damage and the inattention it's received.
Do you see anybody else in the day, any friends or acquaintances?
I have a colleague, a former colleague from Royal Mail over the road, who ironically has just had a stent fitted, so we do share a cup of tea in each other's house occasionally, which we try not to dwell on our maladies, but we've got the work in common, and we have been known to share a pint in the village, so we share a pot of tea these days, but it helps.
Would you ever be interested in taking on more of a regular role, maybe a voluntary role, or anything that could be seen to be consistently aiming towards a certain goal?
I think so. When I've addressed all the shortcomings in my house and garden, I think there will come a day when this list that I write every day becomes more and more spurious and probably has less substance, and at that point I think I will take stock and see what I'm going to do, because I am not ready for just to vegetate. No. And the other thing is, I have a wife who is a little bit younger than me, and she will be working for the next decade, so I think I'll grow old very quickly if I just vegetate.
Do you feel that you're making progress again, having put the cancer kind of behind you to some extent? Do you feel that you've still got improvement still to come?
Oh yes, I'm not there yet. No. Just, I think if things go wrong, or heaven forbid the floods, some challenging thing, it's not impossible for me to take a backward step, Rob. I shall resist it with all I can.
Your idea of the list is actually a very good one. Scheduling activities is a very good one. Another one is to help by asking a friend or colleague to help schedule activities with you, i.e. do things that you're both enjoying together, so that there's a reliance on you taking part. Yeah,
I'm fortunate there. As I say, being secretary of a fishing club which functions at the weekend, but now there's so many of us getting older that we can and do have occasional outings in the week. Definitely. But again, if I did that all the time, A, I'd find it boring, and B, I would find that I would be unhappy with myself. But if I do 3 or 4 days where I've achieved certain things, I feel wholly justified and clean about going out and enjoying myself in that manner.
Yes.
If I were just to go every day and not do anything else, then I would feel a bit out of kilter, I think.
Now, you told me earlier you've got something big coming up that you're looking
forward to. Yes. Tell the viewers about my eldest daughter is getting married. It's the first of my children to get married. It's quite a formal do, so obviously it's beholden on me to do certain things and be in a certain frame of mind on the day, which quite frankly there was a time I didn't think I could face, but at the moment, and it is only about 15 days away, I'm sure that I can rise to the occasion.
And that's a great sign that you've got some of your vitality back and you're looking forward to that big event, because it can be nerve-wracking, but there's no reason you can't go in there with confidence again.
No, well that's it. You've got to have confidence, or the day would just pass you by, and that would be wrong of me for my daughter. My wife, she only that she can't do it all either, and I should and am proud of the young lady and indeed my other children.
Definitely. Let's talk now about resources that are out there. What helped you to cope, and what you think should be out there, even if you didn't access them personally. So first of all, what did you come across?
I was made aware by browsing the various leaflets that are in the foyer of the Osborne building, staffed mainly by Macmillan people, or supported by them certainly, that there were various support groups under the umbrella of coping with cancer, and it gave a whole list of venues and when they meet. And in my case, the most accessible one was in Hinckley, and they were the 2nd and 4th Tuesday in each month. And the function, basically, they offered various alternative therapies, i.e. Indian head massage, something called Reiki. Basically, the whole idea was that they enabled you to relax. Some involve massaging with oils. Some involved the feet, some the head and shoulders, some the head only. There was about 4 options, and it was a pig in a poke for me. I went with Indian head massage, found it therapeutic and helpful. So much so that when I left, they offer you a cup of tea and advise you to have a drink and sit down before you drive. And I felt, yes, I will, because I felt almost that I was in such a laid-back state that I probably wouldn't notice the first set of red traffic lights or something. So it definitely worked for me. And whilst I was doing that and chatting to people, I'm a reasonably gregarious bloke anyway, I found that quite helpful as well, you know.
Yes, so you did come across other patients in the end who were helpful to you.
Yeah, very few direct parallels, but they were struggling to come to terms with surgery, things that had happened to them or were going to happen to them.
Yes. And did you come across did you try any other complementary styles as well as the Indian head massage?
No, because I didn't go that route. I enjoyed it. I thought if it works, I didn't really fancy the one that involved the feet because of the feet were still recovering from chemotherapy. One of them being that your nails go rather unattractive. So I was happy to keep my socks on, if you see what I mean.
Yeah,
so because there was more than one form of head massage. One lady did it with oils and included your neck and shoulders, whereas another did it sort of totally fully clothed, no oils. But I found them both helpful, and they were obviously volunteers.
Yeah.
In fact, it turned out that I knew one of them about 40 or 50 years ago when I lived in Coventry, but she was a nurse, so obviously this was her way of doing something for the community, I guess. And you are invited or allowed to make a contribution to help them help you, sort of thing. And it's not obligatory, but there's an envelope there for you to use at your discretion at the end of the session. And I thought it was a few bob well spent.
I asked you earlier whether there was any resources that should be available, anything that you felt could be offered that perhaps isn't offered.
I just think possibly, rather than letting you dictate the pace of stoma clinic appointments, they ought to possibly make it a minimum of once a month and then use their discretion rather than you tell them how you are, because you might be different one day to another. I mean, they are the expert, and if you suddenly have a stomach upset and you get in an embarrassing situation, you can be frightened. But one of the things that occurred to me was that using Imodium or Lipidamide, everybody knows if you've got a stomach upset that helps. But I thought, dare I start self-prescribing things along with all the other? And it appears within reason that I could, but nobody told me that, and I wouldn't start taking 2 or 3 a day and of my own volition until somebody reassured me that I wasn't cutting across the benefits of some other medication I was taking.
Did you receive any other helpful advice or tips from any quarter along the way?
No.
Which reminds me, actually, I usually ask people at this stage whether you personally would like to say anything to the viewer, given that many of the viewers may be cancer patients themselves, some may be recently diagnosed, some may be stuck with some of the things that you've already experienced and been through. Is there anything you'd like to say to the viewer directly, advice or encouragement?
Just, I think that the early days are difficult. You're normally, if the treatment has proved beneficial, very grateful and thankful, and you sort of look at life afresh, but that can, or sometimes it only takes you so far, and you must realise that there will be setbacks and you won't always feel quite as good about things, but like most of life's experiences, if you hang on in there, you usually find a way to come out of it.
Very good, very good. Well, I want to thank you for coming in today and sharing your detailed experience with myself and the viewers. I think you're somebody who has faced quite a few battles along the way, and a few things haven't gone totally to plan, like the second bout of chemotherapy that you had to have that you weren't aware of. and you had the adrenal problem, which also you weren't expecting. But overall, it seems to me you have fought well, in a sense, against the setbacks, and you've also been able to enjoy certain things and get back to where you want to be. So that's an inspirational account to hear from other people's perspective when they see what you've been through. So thanks for coming in, and thanks for sharing your story, and all the best for the future.
I just hope it helps somebody. Just hang on in there is my sort of short advice. Things do get better.
Thank you very much.